Everybody, we are at Johnson City Eye Clinic here in Johnson City with a really cool procedure that we brought you before, but it's just changing the lives of so many people. It's called Lipiflow, and I'm here with Cindy, who's going to do the procedure, and Kristen, who's going to receive the procedure. But first off, what is Lipiflow?
Lipiflow is a thermal pulsation.
Okay.
We melt the oil that's in the oil glands. We completely empty the glands.
Okay.
About 6 to 8 weeks after they're empty, your body reproduces the oil. It's healthier, it's new, helps your tear production on the eye.
So that's what it's for. It's actually for people with maybe chronic dry eyes, and maybe, how do you get chronic dry eyes? What is dry eyes?
Oh, there's a variety of things. And we're seeing a lot of more younger people as well, but it can be medication related, diagnosis related, aging processes, allergies, antihistamines, decongestants, things like that.
Really? I didn't think about that. There is nothing more irritating than having those scratchy, dry eyes. And that's why you're here, right? Tell us a little bit about your story and why you're doing this.
Well, a couple of things. I work on the computer with my job, so hours every day. That really causes my eyes to feel dry and scratchy and itchy, kind of like sandpaper.
Yes.
And then I also had LASIK surgery many years ago to correct my vision, and so that can cause really dry eyes.
Really?
And it's something I've struggled with for a really long time, so I've really wanted to do this for a long time.
So how long is this going to take?
The procedure itself is 12 minutes.
Really?
That's
And
all.
you're in and out. You literally could do it during your lunch hour, right?
Yes.
How long does it last?
Everybody's a little bit different as far as how bad their dry eye is, but you're looking at anywhere from 12 to 24 months.
Oh my goodness. And for you, you're just like, hallelujah, right?
Yes, it's exciting. I'm ready.
All right, so let's get started. Let's start the procedure and show you guys what it's like.
Go all the way up for me. Way down to
So
your
what are
toes.
you doing right now?
So we've already put a numbing drop in, and right now I'm placing one of the activators that heats up to 108.5 degrees.
Okay.
We're working this right up underneath her eyelids.
Oh, okay. How are you feeling, Kristen?
Good.
Okay.
And that's actually positioned nice. Are you okay there?
I'm good.
Okay.
So it's not hot immediately, correct? It builds up to that. Okay.
That is correct. Once I turn it on, it will gradually increase to 108.5.
So it's kind of like a warming massage for your eyes.
It's a heating pad for the inside of the eye.
Nice.
Exactly.
How long have you guys been doing this particular procedure here?
Exactly 1 year.
Oh, okay. So it's new, but you all have had a lot of success from this, correct?
We sure have. We sure have. You get anywhere from 80 to 85% success on the Lipiflow.
Goodness. And I know that she's happy to hear that as well. I know you're looking forward to it, right? Okay, let's let her get the other eye on, because yeah, you're in there. Does it feel weird me peering over top of you? Seeing what is
it's good.
All right.
It's not uncomfortable at all.
Oh, okay.
Good. Look way down to your toes. There's a lot of people that are hesitant for it because they think that it's painful. They're afraid of the heat. And it's very comfortable.
Well, it's really quiet in here, and it's kind of dark, and you just seem like you're kind of soothing. You're relaxed, set back in the chair in the recliner. And I think this is probably the hardest part of it, right?
This is.
Getting
How's that,
them in.
Kristen? Is
That's
that okay?
good. That feels good.
The hardest part is going to be the activator placement.
Okay.
Every person's eye is a different size.
So, are there appointments leading up to this? How do you find out if they're a good candidate for Lipiflow?
Good question. We actually bring the patients in for dry eye testing.
Okay.
And I will get a picture. It's called a liposcan. It takes a picture of the meibomian glands, which are the oil glands that this heats up. And we look to see, first of all, do you still have any glands? Because you don't want to have the treatment done if you do not have glands that are not able to function.
Okay. Gotcha. So then that's from there you determine. So it's really one visit, one consultation, and then you come in for the procedure if it's right for you.
Exactly.
Okay. Are you ready to get started now?
I'm ready.
Oh my goodness. We're ready to
Are
get
you
started.
ready, Kristen? I'm ready. All right.
Okay, so what's happening right now?
So right now the machine is heating up to 108.5 degrees.
Okay.
So you can see the temperature's going up.
Oh, okay.
Once it heats up, you're going to see some little levels up here that go up and down, and that just lets us know if it's pulsing and draining the glands.
Kristen, how are you feeling?
Right now, it just feels warm. It's kind of soothing.
You look great. No, it really is neat. I mean, nothing's moving. Nothing's. She seems extremely relaxed. So how long does this part take?
For it to heat up, you're looking about 1.5 to 2 minutes.
Oh, okay. And then she relaxes until it takes and does what it needs to do for, like you said, approximately 12 minutes, right?
That's right.
All right, let's come back in about 12 minutes, guys, and let's see how this pans out. All right, so time has passed now, and she's completed her procedure. How are you feeling right now, Kristen?
I feel really relaxed.
Okay, well, good. All right, so go ahead and do your thing. I know that from here, you're just basically removing those, and I do have a question. Is it still hot on you?
It's just a little warm.
A little warm?
It's kind of soothing, though.
Any pain whatsoever? Have you had any?
No,
Nothing.
It's very comfortable.
She seems like she's been very calm the whole time. We've kind of sat here and laughed and chatted pretty much.
It wasn't. I mean, it's just very comfortable.
Very easy. Ooh, and your eyes, they're not red, swollen, oozing, nothing. That was like taking off a pair of sunglasses. It was super easy.
It feels really good right now.
Really? How soon will she start to see a difference?
It's misleading because today she's actually going to feel really good. Tomorrow, probably really lubricated. Her eyes will be moistened. She'll feel worse before she starts to get better because we've emptied all of the glands. There is not any oil in there to secrete for the next few weeks. And that's why we say it can take 6 to 8 weeks to get improvement.
Come on up here and get a close-up shot of her eye, and you can see nothing. She looks just like she did whenever we very first started. So there is no pain.
Not at all. No pain at all.
Oh, it felt wonderful. It was very, very comfortable.
Okay, so my next question is from here. What's the aftercare?
So aftercare is going to be to continue good lid hygiene, take off all makeup, get off all the debris from your lashes. You still want to continue warm compresses. The at-home warm compresses are going to extend and enhance the life of the Lipiflow.
Okay, so from here today, she actually could go shopping.
Of course.
You want to go shopping, Chris?
Sure. Sounds great.
So if they want this procedure, they're interested in a consultation, what's the first thing they need to do?
Call the Johnson City Eye Clinic. If you are established with us, I'd be happy to see you in the dry eye clinic for some testing. If you're a brand new patient, we do like for you to come in and see one of the doctors first.
Oh, absolutely. Absolutely. And I didn't know this, but you guys do everything related to eye care, from exams all the way down to surgeries.
Yes, we do a good variety of things. We have a lot of specialties.
Fantastic. What is your website address?
It's the JohnsonCityEyeClinic.com.
Where are you guys located?
MedTech Park, Johnson City, Tennessee.
I tell you, you know exactly where they are. And come see the sweet smiles here. I tell you, this procedure is relatively new, but I think it's going to be a miracle. We're probably going to have to catch up with you a little bit later to see how you're doing in maybe a week or two or a month. It's Lipiflow. Spell that for me.
Lipiflow.
You guys can remember that. And it's right here at Johnson City Eye Clinic.